second. Now, Dr. Robertson abandoned my care October, I believe the 12th or the 14th, 2014. And I was constantly having to deal with meetings that we would agree on a treatment. This is what we were going to do. When I left the office, all of a sudden, everything changes. And for the Friday night, I had to go to the ER. And I went to the one in Sayre, Oklahoma. It's about 12 miles going due west of here. And I knew that they could not really help me because the seriousness of the problem has gotten much worse. And all that I needed at that point was get the pain under control. Just get me out of it, even if it's for a little while. And they know that I am in real trouble. And I have been down in bed, especially the last 3 to 4 days. I had to get up Friday to mail a package, and just by doing that, I ended up putting myself into considerable amount of pain. I've got this area here in my lower groin. This is where the sigmoid colon is, and I have medical documentation that speaks of the severity of decompression, narrowing, restriction that is in this area. And we also have a diagnosis of a carcinoma that sits in the transverse colon, which is the carcinoma that is spoken on the records that you just saw from Dr. Robertson. And since this month of January, I have got, not only has these two growths that they talk about, this neoplasm. I'll show you what they're. This is, yes, this is, they helped me. I want people to know that there are those here that are helping me, that I am able to get some relief. They're trying. When I went in last night, like I said, it felt like I've got a barbecue grill full of hot coals sitting down in this colon and sitting on the floor of the abdomen. And now here is this benign neoplasm that they're talking about. This sits right here, where this is the umbilicus, and right here is these neoplasms. So this is how big that it is. And I have had where this carcinoma is, which sits right here, is where your pancreas is going to be. Your spleen is over here. This carcinoma sits right here where the pancreas spleen is. And I have, in the past 2 weeks, there is a bulge that has evolved in it. And I went to Clinton emergency room and I got nothing done. Last night I called Clinton ER needing to know what the radiologist report says. I don't want to know what, I already know what the ER doctor says. I need to know what the radiologist report says. I can't hardly breathe. And this was all Saturday, let's see. On into Saturday, wee hours into the afternoon. I was having a hard time breathing. I called Clinton Integris Hospital and was not able to get any help, any information on this. And so I have been waiting trying to make it to Monday, when I might be able to get help through a clinic that I was told about. And today is my birthday, and I have something that has happened to show you what cancer does to the colon through what it's doing to my colon. I was finally able to get the blockage passed. On my CAT scans, you can see the innermost lining of the intestines that it's gone. It's sloughing off. I've got pictures that show there's over a foot at one time that sloughed off. And so the pain and agony that I went through all the night and this entire weekend, and thank God that Sayre Hospital gave me Friday night for being in this excruciating pain. So here is what cancer does to your intestines, to your colon. Let's see if I can get it where there's no... I'm going to try this. Maybe knock off a little more glare by doing it this way. I'm going to try this. Maybe this light. I don't think that helped, did it? Let's do this. Oh my. Okay, let's see if I can't get it up there and hold it still for you. You see how thick those folds are? The skin. Now usually in healthy tissue it is more pinkish. Now this is diseased. It has more of a transparent color, but the bilirubin that the liver puts off is a very dark amber color. And that's where you get the coloration of the food, of digested food. This is why I was having such a hard time breathing. And this is why that the Demerol has been so important, as well as the morphine. Because when this tears off, anything that touches that raw tissue, those nerve endings, after this has been ripped off of me, it's very heavy. That is my insides. This is what colon cancer, what it does. Like I said, I have not been permitted to have any treatments, any consultation with a specialist. They have, because my mom goes to them and has for many years, well, they're not caring for her as well either. But there's my intestines, my colon. This is the reason why that I've been bedridden. My entire left leg is swelling, and I can tell that the cause of the swelling is from what is affecting the sigmoid and laying so heavily against the abdominal wall. I'm going to have to stop this. I'm going to do this part 1. I can't let this go too far, otherwise I might not be able to. Well, I'm stopping it. Go to part 2.